Hi guys, welcome. Today we're going to be going over medical terms, planes, directional terms, regions, and quadrants. But first we're going to get started with some medical terms. We have the cephalac, which is the head, the frontal is the forehead, the nasal is the nose, oral is the mouth, the cervical is the neck, the mental is the chin, the buccal is the cheek, and the orbital is the eye. Moving on, we have the acromial, which is the shoulder, the sternal, which is the breastbone, which is above the thoracic, the axillary, which is the armpit, and the mammary, which is the breast. Up next, we have the pollex, which is the thumb, the carpal is the wrist, the antecubital is the front elbow, the brachial is the arm, the antebrachial is the forearm, the palmar is the palm, and the digital are the fingers and toes. Up next, we have the crural, which is the leg, the patellar is the anterior knee, the tarsal is the ankle, the plantar is the sole, the femoral is the thigh, the sural is the calf, and the digital is the toes, and the hallux is the big toe. Moving on to the back side, we have the dorsum, which is the back. The occipital is the base of the skull. The vertebral is the spinal. The scapular is the shoulder blade. The lumbar is the loin. And the sacral is between the hips. Once again, this is all on the back side. Moving a little bit lower, we see the calcaneal, which is the heel, and the popliteal, which is the posterior knee. Again, this is on the back side. Moving up, we have the olecranial, which is the back of the elbow. Now we're going to be moving on to planes. So the mid-sagittal is parallel to the long axis. The transverse is perpendicular to the long axis, and the oblique is diagonal to the long axis. And up next, we're going to be moving on to some directional terms. So we have the superior, which is the upper, the inferior is the lower, the anterior is the front, also known as the ventral, the posterior, known as the dorsal, is the back, and we have the proximal, which is the point of origin, and distal is the point away from the origin. And then now next, we're going to have some reviews. Again, we see the distal and proximal both on the arms and legs. And now we have the midline, which is the long axis, and the lateral is going away from the midline, and the medial is going towards the midline. Next, we're going to be moving on to regions. Once we're done with this review, we have the right hypochondriac, the right lumbar, the right iliac. In the middle, we have the epigastric, the umbilical, and the hypogastric. And we have the left hypochondriac, the left lumbar, and the left iliac. And finally, we have the quadrants. We have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. And that is our video for today. Thank you so much for watching and for staying tuned to learn more.